please welcome to the stage, with a doctorate in psychology in association with TEDx Cross Cooma, Dr. James Mcgufficke, to talk to you about mental health. Thank you everybody for coming to my presentation. Mental health and the associated disorders are slowly becoming normalised in contemporary society, becoming a part of everyday life and the medical world. Through this societal change, more research has been conducted on the subject. This presentation will explore the economic and social spending in relation to mental health, what causes mental health issues in contemporary society, and a recent study of anxiety and depression in hospitals. Through doing this, the topic of mental health in the year 2020 can be holistically understood. A representation of contemporary society's attitudes towards mental health can be seen in Australia and its clear progression regarding the study, treatment and government spending on mental health. The Australian government breaks down all these aspects easily on their website. In Australia, the framework for mental health services is highly complex, with a mixture of public and private systems, with funding shared between the Australian, state, and territory governments, individuals and private health insurers. The Australian Bureau of Statistics and the National Survey of Mental Health and Wellbeing estimates that 45% of Australians will experience a mental health disorder in their lifetime, with 20% experiencing an episode of mental disorder once every 2 years. The Australian government also does a lot of research into the increase of mental health or behavioural conditions. The most recent national survey, which was conducted in 2017, estimated that 20.1% of the Australian population had a mental health or behavioural condition. This data is important as it shows that 7.2% increase in the number of mental health conditions from 2007. This could be for many reasons: reduced social stigma, social media, more resources to deal with the conditions, more government assistance, and clearer definitions of what these disorders are. With mental health affecting more Australians than ever, the Australian government must dedicate more economic resources to mental health services. The Australian Institute of Mental Health and Welfare estimates that spending on mental health related services in Australia by the government and non-government bodies was around $9 billion between 2016 and 2017. 60% was funded by state government, 35% was funded by national government, and finally 5% was funded by private health insurance funds. This funding was increased from 2007, where only $8.4 billion was spent, mostly being funded by state government. The main thing money was spent on was Medicare, new facilities, residential healthcare, and community mental health care services. Mental health in contemporary society is significant, not only for personal and emotional reasons, but mental illness has a huge impact on the economy. The National Commission for Mental Health found that in 2016, mental health cost Australia around $60 billion. Direct costs of severe mental illnesses arise from the use of health services, as well as indirect costs from people being unable to work due to mental health conditions. What this shows is that the handling of mental health illness in Australia is done exceptionally well and continues to receive praise globally. This is all well and good to know, but why issues relating to mental health have increased needs to be explained. A literary review by James Mcgufficke answered this question. Using multiple research papers, he found a clear correlation between negative mental well-being, the development of mental health disorders, and the use of social media. Social media is only a relatively new part of society, but it has detrimental effects on the mental health of individuals. One study he examined into showed the direct correlation between high levels of Facebook use, poor self-esteem, and increased social comparison. On average, patients who spend more than 7 hours a week on Facebook had an average rating of 3.2 on the self-esteem scale, which is very low. This is 2.4 points lower than patients who spend 3 hours or less on Facebook. Although low self-esteem is not a mental health condition, low self-esteem can affect the mental well-being of individuals. Another study he looked into saw a correlation between a poor mental state, excessive social media use, and the development of mentally ill tendencies. The control group in this were told to only use social media for 30 minutes a day. After 3 weeks of this test, subjects reported a clear increase in positive mental well-being, with feelings of loneliness, anxiety, and depression dropping by an average of 33%. What can be concluded from this literature review is that mental illness is not caused directly by social media, but it produces negative mental connotations, which increases the chance of developing a mental illness. This is a very viable explanation as to why cases of mental illness have increased. Due to cases of mental illness increasing and disorders in contemporary society, more research has been done on this issue, with many research papers helping society better manage and treat these illnesses. What has also been discovered through this is that mental illnesses are not separate from physical health. The research paper, Prevalence and Factors Affecting the Level of Depression, Anxiety and Stress in Hospitalised Patients with a Chronic Disease, was published by Nora Feintmock and a team of researchers in 2019. It researched the prevalence of mental health disorders and the detrimental and determined factors associated with them in hospitalised patients with a physical chronic disease. 150 patients were selected from Notre Dame University, shown up here. They were asked a face-to-face questionnaire consisting of socio-demographic questions such as age, sex, marital status, education level, employment status, income. Social questions, patients' relationships, smoking status, and previous psychiatric problems. Finally, medical questions like type and length of chronic illness. To measure anxiety and depression in the Hospital Anxiety and Depression Scale, or HADS, was used, which consists of 14 questions about each illness, resulting in a score from 0 to 21. According to the HADS, 43.9% of patients had no depression, 29.3% had borderline depression, and 21.3% were clinically depressed. Furthermore, 10% of patients had no anxiety, 43% had borderline anxiety, and 61% had definitive anxiety. What these findings highlight is that the longer stays in hospitals, avoiding thoughts, feelings as a coping mechanism to deal with depression and chronic illnesses, correlated in a higher depression score on the HADS, which is shown here. Females with high blood pressure who were well educated and above average income had higher levels of anxiety, which is shown here. There are some clear flaws and limitations with this research paper, being that the total sample size was relatively small, consisting of 150 people. The sample only came from one hospital, as well as not giving a clear representation of the rest of the world and that country. With the questionnaire being self-reported, some sources of bias may have come into play, such as selective memory and stubbornness from the patient. What can be concluded through this study was put perfectly by the author. Hospitalised patients with physical chronic illnesses have higher levels of psychological distress than the general public, showing the importance of getting psychological counselling in these hospitals. What can also be concluded from this is that mental illnesses aren't just affected by the psychological factors, but also the physical and social environment of the person. Issues surrounding mental health in contemporary society has changed drastically in the last 15 years. Countries like Australia is leading the charge on how the world should be dealing with the complex and diverse issue, spending both social and economic resources wisely. The literature review by James Mcgufficke exhibited that having a negative mindset and poor self-esteem can be due to social media, which is a relatively new thing in society, can lead to the development of mental illnesses and disorders. With more economic resources going to mental health issues, in society studies like Nor's Fagwong's on anxiety and depression can be undertaken to help humanity understand and treat these disorders better. In the last 15 years, mass change has happened in relation to mental health disorders and illnesses, with more economic and social resources being dedicated to the handling of it. Reduced social stigma is good. And finally, the bettering and understanding of these causes and treatments due to research. All these factors are helping society overcome this challenge and tackle it like the real medical issue that it is. Thank you for coming to my presentation. Have a lovely afternoon.